Dante, tell me about the lady you talked to with HER2-positive breast cancer. What is that? I've never even heard of this.
Yes. So this was a tough one. To start, HER2-positive breast cancer. After breast cancer is suspected and some biopsy tissue samples are taken, there are the presence of certain proteins and such on those cells that they're looking for. And this diagnostic process is very complicated.
Okay.
So oftentimes they'll be looking for the involvement of different hormones or hormone receptors. So you might have heard somebody, estrogen receptor positive or progesterone receptor positive, those sorts of terminology. But then you'll also hear HER or HER2 expression as well. It's an epidermal growth factor on the cells that's there for everybody, but they see this in a higher percentage. This leads them to believe that this specific form of breast cancer is present if it's essentially in higher concentrations.
Okay, so the woman you talked to, she was a longtime customer and listener,
yes,
with a history of HER2-positive breast cancer.
And estrogen receptor, that part as well. She was estrogen receptor positive as well, which is separate than HER2 as well.
Okay.
Go ahead.
And she was, so people that have that condition, these are folks who have presumably, I guess, I don't want to say beaten breast cancer, but the acute situation has passed. She is now living past all of this. This is down the road. This isn't the immediate treatment.
Great. Yes, that's a great distinguishing point. She's technically in remission.
Okay.
Mm-hmm.
Okay.
Yes.
There you go. That's
yes.
And she's taking anastrozole as a, what does that do?
So essentially, the research, the overarching body of research at this point supports if you have estrogen receptor positive or hormone receptor positive breast cancer, that you continue on a medication such as this, because this acts directly to, in some way, shape, or form, suppress the hormone that gave rise to this tumor growth and cause of cancer. Okay,
so the drug is helping to reduce the risk of recurrence?
That's exactly what it is.
Okay.
The hopes are that if you stay on this for a certain amount of time, after you've completed, if you've had surgery, if you've had radiation, if you've had chemo, if you've had, monoclonal antibody therapy or biologic therapy, that this is to keep, keep your risk of death down and to keep the risk of recurrence down, both of those things separately.
Okay.
Yes.
And so this drug, anastrozole, has some side effects.
It does. So understanding the side effects, it's easier to understand this if you know exactly what the medication's doing. So it's technically an aromatase inhibitor.
Okay.
All right. And so there's aromatase receptors kind of throughout the body. There's some in the liver. There's some in fat cells. And so even if you're postmenopausal, you still have the ability to produce some estrogen. And that's there's a little bit coming from the liver, again, a little bit coming from the fat cells. So by suppressing or inhibiting this enzyme, which converts to estrogen, that allows you to kind of decrease the concentrations that are floating around in the body. And the hopes are that because this particular individual was susceptible to an estrogen component to the breast cancer, that you prevent that from those cells from proliferating again, basically.
Okay, so let me make sure I'm understanding this right. So the estrogen is the issue in that, for whatever reason, the breast cancer cells are receiving it excessively and are activating.
It's like stimulating the cancer.
Yes.
It's adding fuel. It's adding kind of fuel to the fire.
And so by taking anastrozole, it's reducing the precursors to estrogen. So theoretically reducing the levels of estrogen in the body.
Yeah, so that breast cancer fire is theoretically out at that point. You're trying to make sure that there's no little smolders, that this fuel that was in there can be added to it. So you're going overkill a little bit in a sense, because you are in remission at that point. But it's so effective, and it's known that it is the fuel to the fire. That's why it's done. And there's been studies on it for years.
Is this done, I guess, for any woman that has breast cancer? And guys can get breast cancer too, but this would be primarily female because the estrogen component.
So
correct?
it boils down to whether or not basically their hormone receptor status.
Yeah.
So in the event that they were positive for the presence of those cells on their biopsy, that they ultimately would qualify post-treatment for this kind of prevention of recurrence. Yes.
Okay. So it's given to anyone who is in that situation,
70
whether
to
they
80% of breast cancers.
Wow, I didn't realize that.
Yes.
Yes, should have mentioned some of that. Yeah.
So this is anybody who has had that. It's not just postmenopausal or perimenopausal. Is that right? Did I say the right words? I'm learning these things. It's any status, and if you've not hit menopause as a woman and you're taking this drug, I imagine that's going to have a pretty big impact on your lifestyle as well.
Yeah, that's a good point. That's kind of that would be sort of a
separate question.
A separate question.
Sure,
There's
okay.
a different medication that works similarly to aromatase inhibitors. So, for example, they might put somebody who's premenopausal on tamoxifen.
Oh.
There's less of an effect on that sort of thing. So that's a little beyond the scope of this.
But so if you're on an
but that's a
estradiol,
great noticing there for sure.
It's a fair guess that this is a postmenopausal woman.
Exactly.
Got it. Okay, so
Yes.
So that being the case, she's dealing with the side effects, which are
There's
joint issues.
There are an array of things that women can experience with this, which is unfortunate because all they're trying to do is prevent the recurrence, which is the name of the game in this case, but it certainly does not come without its downsides. And
right.
And the one that you often hear people who they stop taking their medication because of it, they often have hot flashes, they can't sleep. I mean, it's pretty serious.
Yeah.
And you don't want to see women get to that point.
Right.
But you certainly understand why they would, because on one hand, who doesn't want to live longer ultimately?
Right. Yeah.
But at what point why would you want to sacrifice the quality of life that you currently have? So I'm totally, I feel for the decision that they have to make. And ultimately the short answer to this question is that she has to have a very honest conversation with her clinician about this, with her oncologist too.
Right. Because the question ultimately was, what is
do?
this? What is it doing to me? Do I need to keep taking this? And are there any alternatives?
Yeah.
And you're saying you got to talk to your doctor about that.
Absolutely. And just, for elements of encouragement too, we mentioned tamoxifen. There are other medications, again, similar that for whatever reason, again, because we're all individuals, that, she might have less side effects with tamoxifen than she would in astrazole, or vice versa. There's exemestane, which is similar. They might want to, again, switch her medication altogether. She might take they might have her stop taking it for a little bit. Who knows? I can't speak to exactly what they would do, but ultimately the benefit is there. The papers prove that the benefit is there as far as the absolute risk reduction and such of cancer recurrence. So the other thing that we would need to know from her ultimately, like for example, if Joyce would see her in a consultation,
Sure.
The types of tumors specifically, what staging, the invasiveness of it, did it metastasize to lymph nodes? All of that matters. As far as should she take this in astrazole for 5 years? Should she take it for 2 more years? Should she take it for 10 to 12 years? That all matters.
Yeah.
And so in essence, the more severe her case was, even though she's in remission now, the more severe that the actual cancer was, I would have to make the argument that's the longer that you would want to stay on it.
Right.
How long? We're not oncologists, but that's the principle. And it is it's totally well-meaning.
Yeah.
As far as why you would want to continue that as long as she would.